If you have back pain and you go to see a doctor, there are certain types of medications that they will put you on. The first one is anti-inflammatories. When you injure your spine, the nerves can become inflamed and irritated, and you can certainly experience pain. If you take these anti-inflammatories, they will diminish the inflammation and therefore diminish the pain. The next type of medications they will commonly prescribe is muscle relaxants. If you injure the spine, muscle spasms can occur and can certainly cause pain. These medications will relax the muscles so the pain isn't as severe. And then there are painkillers. From our perspective, there are a couple of risks with painkillers. Basically, painkillers can cause addiction. If you've been on these medications for an extended period of time, your body will actually need the drug to function. If you don't get the drug, then your body will go through withdrawals. Another problem experienced when using painkillers is that people can develop tolerance to the drug. As your body adapts to the medication, you need a stronger, more potent narcotic. And if you've been on painkillers for a long time, you know what I'm talking about. Your doctor may have started you on a mild painkiller that might have helped for a little bit and then it stopped. He put you on a stronger medication and that worked for a short time as well, eventually resulting in stronger doses without results. What is happening here is that your body is adapting to the narcotic and is requiring a more potent drug to get the same effect. At Laser Spine Institute, we feel that painkillers should only be used for a short period of time. Our philosophy is to take care of the pathology so you no longer need the narcotics to function. Other modalities for treatment include chiropractic treatment. I believe chiropractic treatment can benefit a lot of patients. I do feel, however, that if a chiropractor has been treating you week after week, month after month, and the pain still continues, you should see a specialist. Pain management is another option. Pain management physicians can perform injections such as epidural steroid injections, selective nerve root blocks, facet injections, and trigger point injections. All of the stated forms of treatment can certainly help with alleviating the pain, but are not going to treat the underlying problem. And then we have physical therapy. There are certainly a lot of modalities in therapy that can be a benefit to the patient. There's E-stem, ice, ultrasound, and of course massage. Physical therapy can help build the muscles to support the spine and therefore prevent further problems. But if you have an underlying pathology, physical therapy will not change that pathology. Acupuncture is another modality that people will try. Acupuncture causes the body to release its own painkiller, which is called an endorphin. The needles are inserted and endorphin is released and you temporarily feel better. Then, of course, there is traction. Traction has been around for many years and it can certainly help. However, there are a lot of conditions where traction will not be able to change the anatomy, and over time the force of gravity will force the spine back down and symptoms can reoccur. When you are evaluating someone for a possible spine condition, the best test, in my opinion, would be to get an MRI scan. An MRI scan is a fascinating instrument. It is actually a magnet. It takes pictures of the inside of the body and gives tremendous clarity of the spine, the spinal cord, and the nerves. There are patients that cannot undergo an MRI. These patients usually have pacemakers or hardware in the spine. Also, people with surgical clips would not be able to undergo an MRI testing. In these cases, a CAT scan would be in order. Some doctors like to order myelograms. A myelogram is an injection of a contrast into the spine.